Okay, it's 10 o'clock, and I would like to welcome you all to this side event where we will be addressing the harms of criminalization and policing with criminal justice and drug policy reform. It's a side event that the government of Norway arranges together with the Norwegian Association for Humane Drug Policies, the International Drug Policy Consortium, Street Law Philippines, NoBox Philippines, Release from the UK, and the Drug Policy Alliance from the USA. And as many of you already know, the Norwegian government just proposed amendments to the Municipal Health and Care Services Act and the Penal Code with the purpose to decriminalize use and possession of smaller quantities of illicit drugs for personal use. In Norway, as in many other countries, there has been a major change regarding how society should deal with drug problems, including the way society looks upon people who use illicit drugs. This change is mainly steering away from punitive measures toward a more health-oriented approach, in accordance with the principles of human rights and including the participation of people who use drugs and civil society in decision makings. So in January 2016, a drug policy reform became official policy for the current government. The purpose of this reform is to ensure better services for people suffering from substance use disorders through transferring the responsibility for society's response to use and possession of illicit drugs for personal use from the justice sector to the health and care services. By spring 2018, a public committee to explore and assess a model for the implementation of the drug policy reform was appointed, and the proposition is mainly based upon the committee's report. The committee's starting point is that punishment is society's most severe instrument to counteract and condemn undesired acts of its citizens, and therefore requires solid reasons. And in this context, punishment can only be justified if criminalization is suitable for reducing the adverse consequences of illicit drug use, and at the same time, other responses would prove to be purposeless or inadequate. In addition, the benefits of punishment must clearly outweigh any other harmful effects. According to the committee, the best available knowledge does not provide good empirical evidence for beneficial effects of criminalization, such as a potential preventive effect of illicit drug use. On the contrary, evidence do provide quite a clear basis for establishing that criminalization and punishment of drug use has unintentional as well as intended adverse effects. Furthermore, there is no empirical evidence showing that decriminalization of illicit drug use or possession for personal use would necessarily result in a noteworthy increase in drug use of illicit drugs. There is good reason to believe that adverse effects of illicit drug use, both on a personal level and in society in general, is better countered with health and welfare services, mainly based on consent and without coercive measures and the threat of punishment. So this is, in short, the baseline of the Norwegian drug policy reform as proposed from the government. So this is sort of the backdrop to our seminar today. And I am very happy that we have an excellent list of speakers. Before we start off with our first speaker, I would just like to say that if you would like to pose any questions, please use the Q&A functionality in Zoom. And I hope sincerely that we will have some time after the presentations to ask those questions to our panelists. Please also stay muted when you're not speaking, and only unmute if you have the screen. So this leads us to our first speaker today, Edson Yarcia, Policy and Research Officer, NoBox from the Philippines. Lee will talk about the current war on drugs in the Philippines, the impact on human rights and the criminal justice system in particular, and the links to poverty. He will also mention some reforms underway in the Philippines. So Lee, you have the screen, and I believe that we will see a video intervention. Thank you.
Ambassador Kirsi Andersson of the Norwegian Mission in Vienna, fellow panelists and advocates for criminal justice and drug policy reforms, state representatives and participants in the 64th session of the UN Commission on Narcotic Drugs, colleagues and guests, warmest greetings from the Philippines. On behalf of NoBox Philippines, we'd like to thank you for this opportunity to address the topic of criminalization and policing to people who use drugs, and the aspiration to realize genuine reform grounded on our collective sense of humanity as a community of nations. Psychoactive drugs play a meaningful role in the lives of people in the Philippines. In our 2018 ethnography work in an urban community in Metro Manila, we found that drug use figures in everyday lives of the people. Methamphetamine acts as pampagilas or pampagising for workers, helping people feel more energetic and alert as people worked at night or for long hours, in an economic labor setting where manual labor is the main capital for low-income families. Marijuana enhances merrymaking during social gatherings of young individuals and serves the same role as alcohol in drinking or inuman sessions. Many other studies have shown economic, social, and cultural dimensions of psychoactive substance use, which still exist in the Philippines up to this day. The dominant social-legal order, however, does not fully recognize the lived realities of people who use drugs and their communities. The international drug conventions have been used to justify domestic criminal legislations that created a prohibitive environment for people who use drugs, utilizing jails and prisons as quote unquote corrective tools to shape moral beings who do not have sinful vices, and countries invested in a medicalized approach to quote unquote treat people who use drugs to cure them of their illnesses. In the Philippines, the same prohibitive environment fuels the war on drugs, where extrajudicial killings, persecution, stigma, and discrimination against people who use drugs occur under an absolute and non negotiable goal, that of creating a drug free society through substance prohibition. This same criminal and law enforcement model blinded many states from the reality that abstinence pushes people away from health and social services for fear of incarceration or even death, and leads to risky substance use practices that contributed to the twin epidemics of HIV and hepatitis C in the Philippines. The same criminal and law enforcement model created inhumane condition in Philippine prisons and jails, which are presently about 500% overcongested, with 85 to 90% of the detained population incarcerated for drug-related offenses. This is the same criminal and law enforcement model that shares abstinence-based goals in compulsory centers for drug use and quote-unquote rehabilitation centers, where people who use drugs are stripped of autonomy, subjected to regular drug testing, and will only be deemed cured if they stop using drugs. But despite decades of drug prohibition, whether through the criminal justice system or through medical prohibition institutions, people continue to use drugs even at great risk for their lives and their families. It is high time that we finally accept the well-established fact that psychoactive substances play important economic, social, and cultural roles in people's lives, and a criminal and law enforcement model brought more harm than good in our society. Our years of community work with people who use drugs have shown that care, support, and people centered programs effectively address drug related harms and risks through a wide range of services and responses. We have good hearted partners in the Philippine Dangerous Drugs Board, which recognize the global data of UNODC that as much as 87% of people who use drugs are non problematic, and that the focus of government responses should be on health, economic, and social dimensions of substance use. we aspire for a criminal justice and drug policy reform that stands on the following urgent changes in our social-legal order. First, decriminalize drug use and possession of drugs for personal use. People involved with drugs should be taken out of jails and brought back to their supportive families and communities. Decriminalization of drug use entails reframing drug issues as primarily a socio-economic phenomena. The government must build a resilient and responsive system towards economic emancipation and must invest in human development, which eventually fosters long-term and practicable solutions to drug-related issues. Full and productive employment and decent work for people involved with drugs reduce vulnerability to criminal exploitation and abuse. Providing adequate education opportunities and addressing poverty to improve life expectancy, health, and other human development indices create enabling environments that disincentivize participation in problematic drug trade. Number two, decriminalize interventions, demedicalize interventions for people who use drugs. Compulsory treatment centers and the medicalization of psychoactive substance use have no place in an evidence-based drug policy framework. The promotion of health of people involved with drugs should be the priority of the government. Health understood as the complete physical, mental, and social well-being and not merely the absence of disease or infirmity. Comprehensive health services that provide coverage for HIV prevention, treatment and care, treatment for substance dependencies, including substitution treatments, access to sterile injecting equipment, and essential health services for people involved with drugs must be put in place. Policymakers must be primarily concerned with preventing adverse health outcomes related to drug use, such as fatal overdoses, prevalence of blood-borne diseases and other infections, and drug-related deaths, including self-harm and accidental deaths. Number three, establish a genuine public health approach to drug-related issues, embraced within the philosophy of harm reduction. Harm reduction refers to policies, programs, and practices that primarily aim to reduce the adverse health, social, and economic consequences of the problematic use of legal and illegal psychoactive drugs, without focusing solely on drug consumption. Harm reduction dispels that archaic belief that abstinence is the sole and primordial goal of drug policies. As shown by history, people will use drugs because psychoactive drugs play a meaningful role in their lives, whether that role be cultural, social, or economic. The collective responsibility is to ensure that people and their communities are kept alive, safe, and well, whether or not they are involved with drug use. A prohibitive environment is concerned with moral failings, while public health and harm reduction is concerned with safety and well-being. It's time to decriminalize drug use and embrace a public health framework, not only because history and evidence demand so, but more importantly, because our humanity dictates so. Maraming salamat, magandang araw sa inyong lahat. Thank you and have a good day.
Thank you so much, Lee, for your intervention. We will now move on to Yarcia Naidu, Managing Director, Department of Legal Affairs Drug Policy Alliance from the US. And this will also be a video intervention. So please, Yarcia, you have the screen.
Hello, and thank you to our co-sponsors for organizing this online side event. I'm thrilled to be on this panel and to participate in this timely discussion. To give you a roadmap for what I will be covering during my presentation, I'll highlight some of the harms associated with the decision to use our criminal justice system as a response to drug use and drug possession. Then I will talk about a recent reform that was adopted in the state of Oregon, and highlight some of the policy aspects of the Oregon model. And then I will conclude with a discussion of what has happened since Oregon adopted its innovative drug policy. I also want to just clarify that my comments are all going to be focused on the United States and US drug policy, and my esteemed colleagues on this panel will address drug policy issues in countries, in other countries around the world. So starting with the harms of criminalization, more people are arrested for the possession of drugs for personal use in the United States than any other criminal offense. So drug possession is the single most arrested offense in the US. Disproportionately, these individuals that are caught up in the criminal justice system for drug possession are Black and Indigenous communities and other communities of color. The consequences of an arrest are very serious and could lead to loss of employment, loss of housing, impact on family obligations, impacts on educational opportunities, and a whole host of other negative consequences. In terms of the health aspect and the health consequence of criminalization, we've seen high overdose rates in the United States. And the decision to use or not use substances, as well as overdose rates, don't rise and fall based on how punitive a policy is. As a result of treating drug use through the criminal justice system, we've seen a huge investment in the system of punishment, in the system of arrest and prosecution and incarceration, and really a lack of investment in treatment and harm reduction services. So as a response to this very punitive model that we've been seeing the last 50 years, in fact, this June will be the 50th anniversary of the declaration of a war on drugs in the United States. Confronted with high overdose rates, high incarceration rates, and lack of access to meaningful health, treatment, and harm reduction services, the state of Oregon this past November voted on a ballot measure that effectively would eliminate criminal penalties for possession of drugs for personal use and expand the infrastructure to provide health services and harm reduction services and recovery and peer support services for individuals who want or need them. The ballot measure was a voter-enacted reform, and the victory has made Oregon the first state in the United States to take this major step forward towards dismantling the system of criminalization that has harmed communities of color for the last 5 decades. So specifically what the Oregon measure does, it was called Measure 110, and it decriminalized drug possession. So it eliminated criminal penalties and imposed a $100 fine for possession of drugs for personal use. It's important to just highlight that the fine is something that can be avoided if the individual who gets a citation opts to get a health assessment or get a screening where they could get access to treatment and other services. The measure also funds services through various revenue sources. Oregon legalized cannabis for recreational purposes, and revenues from cannabis taxes from the sales of cannabis has been earmarked or identified as a way to fund treatment and recovery services. Additionally, cost savings from reduced arrests, reduced prosecution, reduced incarceration costs would also be deposited into a treatment fund to expand access to services. The Oregon measure just took effect on February 1st, so it's too soon to have any kind of meaningful data. But what I will say is that while this ballot measure was pending, the state's Criminal Justice Commission did a study on the racial impact and found that the reform is expected to result in a 95% decrease in racial disparities in drug arrests. The other aspect that the Criminal Justice Commission highlighted is that there are racial disparities in every step in the criminal justice process, from the point of the initial decision to stop an individual, to arrest a person, in jail bookings, the decision to hold people pre-trial, decisions by the prosecutor about whether to file charges or not. Adoption of this measure could impact disparities in every step of the process. Since Oregon passed, there have been a number of states that have introduced legislation at the state level, primarily concentrated in the Northeast, but we also see bills in the middle of the country, for example, the state of Kansas. The Washington State Supreme Court found that the drug possession law was unconstitutional, and the state legislature is now actively trying to address a response to the decision that struck down the drug possession statute in that state. So in looking back at the last few years, decriminalization was really an issue that was discussed among advocates. But in seeing what has happened in Oregon, where there was overwhelming public support for trying something different, and now seeing that there are bills pending in 8 states in the United States, and imminently there will be something at the federal level as well, it's clear that decriminalization is a policy whose time has come. Thank you again for organizing this panel, and that's to our co-sponsors. And I look forward to hearing the rest of the presentations. Thank you very much.
Thank you so much, Yarcia. My next speaker is Adria Coates-Fernandez, Research and Advocacy Officer from the International Drug Policy Consortium. And Adria will present the conclusions of 2 IDPC reports, focusing mostly on the solutions and policy recommendations. Adria, you have the screen.
Thank you very much, Madam Ambassador and dear colleagues. Thanks for the opportunity to take part in these important discussions. As the Ambassador mentioned, I'm going to present the findings of 2 recent IDPC reports. So if you could change slide, Marie, please. The first report highlights the tension and conflict between punitive drug laws and the commitments on women's rights assumed by the international community in the UN Bangkok Rules. And the second report focuses on prisons and COVID-19, and it uses 4 national case studies to highlight how punitive legal frameworks have impacted the health of people incarcerated during the pandemic. Both reports reach a common conclusion. Any effort to advance gender equality, to promote health, or to change our prisons needs to engage in the reform of drug policies. If not, it will be undermined by punitive and outdated drug laws sooner or later. This is an important lesson for policymakers. Change of slide. Though women are a small minority of people deprived of liberty, the global female prison population has risen dramatically in the last 20 years, growing by 59% in comparison to 20% in the case of men. That is 3 times as fast as that of men. This increase has not been equal across regions. According to Penal Reform International, the number of incarcerated women rose by 50% in Asia and by 19% in South America, but it decreased by 29% in Europe. In this chart, we see some shocking examples. So what has happened? What has driven such an increase? Well, the explanation is in good part due to drug laws. In many countries in Latin America and in Asia, including those in the chart, brutal and draconian drug laws were adopted in the 1980s and 1990s. In some cases, due to international pressure, as Lee mentioned for the Philippines. the increase in penalties was inevitably followed by an increase in prison populations. Next slide, please. Research from the Washington Office on Latin America shows the gendered impact of these laws. For instance, as you see in this chart, in Brazil, 62% of women were detained for drug offenses, but only 25% of men. The same goes for Costa Rica and for many other countries in the region. All in all, in 2018, the UN estimated that 35% of women in prison worldwide are incarcerated for a drug offense, compared to 19% of men. Change the slide, please. So we published in February a report on the UN Bangkok rules on the treatment of women in prison. And I think that from the close reading of the Bangkok rules that we did in that paper, 3 key principles emerged that could be the basis for broader criminal justice reform. The first one is that prison must be a measure of last resort. With the Bangkok rules, all states committed to promote non-custodial measures, such as diversion, provisional liberty before sentences, or early release for all women. The rationale behind this was clear. Evidence shows once and again that the reasons for which women get involved in the illegal activities, particularly in the illegal drug economy, are poverty, caretaking responsibilities, and in some cases coercion, past trauma, or violence. There is simply no reason to believe that these factors will be adequately addressed in prison. In spite of these commitments, the reality is that in many countries, people who are charged with a drug offense are, by law, simply not eligible for an alternative to incarceration, no matter what they did, why they did it, or what was their personal situation. In other countries, alternatives to incarceration are available in paper only. In good part, this is due to the fact that women have less access to legal counsel, to money, and to social networks that are necessary in order to extract from the legal system these benefits. Second lesson, pay attention to the circumstances of each person. Under the Bangkok rules, states must allow courts to consider mitigating factors in sentencing. In practical terms, a mitigating factor is a personal circumstance that entails a reduction of responsibility for a person that commits an offense. Mitigating factors can include a history of drug dependence, a background of poverty, discrimination, and disability, or just having had a very low level involvement in a drug organization, for instance, by being a courier. In practice, many drug laws establish high minimum prison sentences for even very minor drug activities, including for drug use and possession for personal use, without considering any mitigating factor. The only fact that's taken into account in sentencing a person involved in a drug activity are the type and the amount of the drug involved. The personal background and circumstances are disregarded, and the stories are erased. And lastly, third lesson would be to avoid a gender-blind approach. The impact of drug policies is not gender-blind, and drug laws should not be gender-blind either. The reasons and ways in which women are involved in the illegal drug economy are different than those of men. The consequences of incarceration are also different. The resources available to women when they deal with the criminal legal system are also far more limited. Next slide, please. And the tension between alternatives to incarceration and punitive frameworks is one of the issues covered in our report on COVID-19 and prisons. As of today, at least 538,000 people in prison have tested positive for COVID, and at least 3,900 have died from it. These figures are likely to be a gross underestimate, as many cases go on without testing. At the outset of the pandemic, many UN entities called for the reduction of prison populations to prevent the spread of the virus. But the follow-up of many states has been disappointing. Harm Reduction International has estimated that the number of people in prison has been reduced in only about 6%, which is a drop in the ocean. Our report provides a case study on Indonesia, produced through interviews with the NGO LBH Masyarakat, because the Indonesian government had put in place an ambitious plan to reduce overcrowding, which led to the decarceration of 40,000 people. However, the report shows that many people convicted for drug offenses were excluded from this scheme, no matter their personal circumstances, even if they were old or they had health conditions that put them at risk. This was because drug offenses were considered an extraordinary crime that was so serious that it was incompatible with prison releases. Literally an extraordinary crime. Given that 50% of the prison population in this country is incarcerated for a drug offense, it's hard to see how such crime is extraordinary. And though the law aimed to exclude minor drug offenses like drug use, this was not effective in practice, as many people found in possession of drugs are charged directly with the supply offense, even if these drugs are used are intended for personal use. Change the slide, please. Another important way in which our research on COVID-19 and prisons highlights the distance between international commitments and reality is access to health. Under the Bangkok rules, women deprived of liberty should be provided with individualized, gender-sensitive, and trauma-informed mental health care and drug treatment, amongst many other support and social and health services. Even before the pandemic, compliance with these commitments was in general very poor. But the preferred way in which many countries acted to prevent the spread of the virus in prisons, which is by isolating detention centers from the community, has made it worse. In a rich country like Ireland, for instance, the NGO Fusion Community Prison Links told us that by December 2020, there were still clients whom they had not been able to contact since March 2020, 10 months earlier. In some prisons, social workers were only able to contact clients through video calls. Many calls cut off after 15 minutes, suddenly, without a warning. The impact on mental health was devastating. In Colombia, our colleagues from Corporación Humanas, also interviewed for the research, explained that since the beginning of the pandemic, women in prison have been isolated from their families, which in that case also means that they are isolated from their main source of essential goods, such as food or health products. Prisons also prohibited access to external staff, such as social workers, psychiatrists, and gynecologists. Women were provided with only one pack of menstrual pads over the course of 3 months. Next slide, please. So this is our last slide. Of course, both reports finish with a large number of recommendations because that is what us advocacy organizations do. But at a very high level, I think we could categorize them in 4 groups. First, make prisons the exception, not the rule. Second, for those that remain incarcerated, ensure access to gender-sensitive healthcare, including mental health and drug services, equivalent to that available in the community. Third, provide accommodation, employment, and support to people after their release, and practices that exclude people who have been in prison and people who use drugs from access to the formal economy, housing, and financial services. And lastly, of course, decriminalize use and possession for personal use. In sum, for women as well as for men, prison is not an appropriate or effective place to address the reasons for their involvement in the illegal drug markets, which are overwhelmingly poverty, marginalization, and lack of opportunities. In many cases, prison is also not a just response. Thank you very much.
I thank you so much, Adria, for your presentation, also updating our knowledge on the effects of the COVID-19 pandemic. My last speaker, but no way least, is Arild Knudsen, leader of the Norwegian Association for Humane Drug Policies. And he will present Norway's move towards decriminalisation with strong community involvement, what that will mean for the lives of people who use drugs and all those caught in the criminal justice system. Arild, you have the screen.
Thank you so very much. And first of all, I have to thank you so much for co-organizing and participating at this event. As you said earlier, in Norway, we are in the midst of a drug policy reform right now, and therefore also in the midst of a very large debate about criminalizing and policing. And we still don't know what the final result will be, but nevertheless, it is remarkable that our country has taken this step. Norway is a conservative country with a conservative government, and our nearby countries such as Sweden and Denmark are not even close to look into decriminalization, to say the least. So how could Norway get into a drug policy reform with a governmental proposal to decriminalize drug use? I think it can be best explained by focusing on the harm reduction situation in Norway and the previous drug reform which took place in 2004 and gave people with drug addiction patient rights. At the same time, there was established a national substitution treatment program with methadone and buprenorphine, And when it comes to harm reduction, we were very early on for being a country in Scandinavia with establishing needle and syringe programs in the 90s and to open a drug consumption room in 2005. Drug use was still criminalized, but since then, the health-centered approach, the tolerant and the pragmatism has grown, and several drug user organizations have been established. What we could see early on was that on one hand, we help and include, on the other, we punish and exclude. On one side, forces in the country fought for more help and inclusion, and on the other side, forces in our society fought for more punishment and exclusion. The health-centered approach brings evidence on what works and what doesn't. The organization I represent, the Association for Humane Drug Policy, is a drug user organization and was established in 2006 as a result of these ongoing debates. We had to organize because we stood up against big organizations and at that time, most of the politicians. We are promoting substitution treatment and harm reduction and opposing criminalization and brutal police actions against users and the open drug scenes. We have a high media profile and we meet our opponents with the utmost respect. And since 2008, we have paved the way to be invited into the parliament together with active drug users every day. Some of the authorities wanted us to be just a patient organization and only participate in the healthcare system, while organizations from the temperance movement could work on the political level and represent Norway internationally. But nothing about us without us. We also are a political force. We are not criminals because we use drugs, and we are not patients because we use drugs. First of all, we are citizens. We deserve not only patient rights, but also human rights to be treated as equal. Criminalization of drug use does not prevent drug use. It only creates stigma, marginalization, and it creates crimes, and it creates most of the elements in what we call drug problems. Criminalization is actively counterproductive. Very few of those who have drug problems seek help because of the stigma. An individual with drug-related problems doesn't find a health-oriented approach very interesting as long as he or she is treated as a criminal being. As long as we are criminalized, the health-centered approach is also very narrowed and moralistic. In 2016, we wrote a petition together with some other drug user organizations in Norway's biggest newspaper. It was signed by 90 public figures, academics, politicians, and lawyers. And there we demanded to be listened to, that human rights must form the basis of all drug policies, and that the use and possession of drugs for one's own use must be decriminalized without being replaced by new and intrusive sanctions. The Minister of Health, Bent Høie, has since stated that this was a turning point for him. In 2017, it became clear that the majority of the representatives in parliament supports a move from justice to health. And in 2018, the government formed a drug reform committee to look at the findings from many countries. The drug reform committee did extensive research for a year, and in 2019, the committee suggested a model for decriminalization of drug use. Last year, in March, the Minister of Health, Bent Høie, and the leader of the Drug Reform Committee held a side event at CND about the findings and suggestions. The framework consists: the police will continue to uncover drug use and possession, and the police will have the authority to search people, but we are to move from a punitive to a supportive approach. Instead of being punished, drug users will have to meet for a municipal counseling unit. The proposal from Norway was very well received by representatives from the World Health Organization, the Office of the High Commissioner of Human Rights, UNODC, and several other high-level organizations. In short, they received it as best practice within and fully consistent with the conventions, and they said, look to Norway. In February, the government presented their proposal, just a little more conservative, but in principle the same. The parliament shall vote over the proposal in June, and we still don't know how it will turn out. At this point, it is a thriller, but we are clearly on a route to a more humane drug policy based on evidence and human rights. Ladies and gentlemen, my name is Arild Knudsen, and in a copy of the government proposal, the Minister of Health, Bent Høie, wrote to me, "Dear Arild, this is Lex Knudsen. That means the Knudsen's law." In that, the Minister of Health showed his remarkable exception for the drug user environment. And as he said in Vienna in March last year, the civil society has been the driving force for this reform. We hope that this can be of inspiration for other states to involve civil society and people who use drugs in their effort to addressing the harms of criminalization and policing with criminal justice and drug policy reform. Thank you so much for your attention.
Thank you so much, Arild, for that very, very powerful statement. I am sure, and I see also from the chat, that you participating here is really it's bringing a great contribution to this panel. I am now opening up for questions and answers in the Q&A area of the chat, where you can find it. And I'm sure that there will come some questions as we go along. And as we wait for questions to come, are there, Arild, where do you see, how do you read the debate today in Norway? Where do you see that the challenges are? And how do you, how would you and your organization approach the debate that is coming on where this drug reform will eventually conclude or end?
Thank you. I think it is very hard for many to understand that punishment does not stop anyone from using drugs. This is quite new for us all. So we have to have a good debate about this and understand that people are afraid that we will have a negative that it will have a negative impact in the society. But we do have this report that clearly states that punishment does not prevent drug use, and that it creates crime, and it creates that it pushes people out in marginalization and very bad health situation, and many people die of overdose. So I really hope this debate will land this reform, and that we will the majority of parliament will really vote for this.
Thank you so much, Arild. Lee, I would like to move to you. What if you were to say, speak about the 2 or 3 biggest immediate challenges that you face? What would they be, and how would you think that you could actually participate to find solutions to those challenges? Thank you.
If I were to identify top 2 issues in the Philippines right now, the first would be the direction for legislative reforms. There is a movement to create a more punitive environment in the Philippines for people who use drugs. These reforms do point out additional presumptions of criminal responsibility and a reintroduction of the death penalty for drug-related offenses. And also, if you look at the way the government is trying to institutionalize the war on drugs through local government units, that's a very important challenge that we need to monitor. But on the converse, we see that there are spaces for pushing for reforms, because some of the bills do have a promise for implementing a more public health approach. So it's really a matter of shaping those legislative reforms. So that's the first general challenge I feel, focusing on the legislative directions in our Congress. The second one, I'd highlight the UN technical assistance in the Philippines through the joint program. I wouldn't say it's a challenge, but more of it's an important opportunity, because the international community right now is focusing on the Philippines. And if we can come up with a good model for reform, how we can shape a punitive environment towards one that promotes public health, then that would be an important success for all of us. And so I'm highlighting the UN Joint Program because that's a space for our international partners and communities to push for more public health approach, decriminalization, demedicalization, and hopefully bringing all these insights from the experience of Norway and from the reports that we have into something concrete and something well-funded in the Philippines. Thank you.
Thank you so much, Lee. I see that there is a question in the chat, and I will read it. I think this goes to Arild. How do the top government officials in Norway see drug-related cases? Is it in any way nearer to seeing it as a medical health issue rather than a criminal issue? Arild, would you care to answer that?
If I understood the question right, it has been seen as a criminal issue, and it's still seen as a criminal issue, but the government and the politicians, the authorities is now more and more seeing it as a medical issue. But as we know, it's just a few of people who use drugs who are really sick. We are citizens. So I think there's a groundbreaking change in the attitudes toward drug users in Norway today.
Thank you so well. There is another question for Lee. If I can just find it here, I think maybe in the chat. How do you continue your advocacy in such a repressive environment as is currently the case in the Philippines while ensuring that you remain safe? And have COVID-19 measures impacted on your advocacy work further?
Okay. In relation to our advocacy work, well, there is a bit of safety if we work in great number. And so, for example, in our legislative advocacies, we want to broaden our civil society network. We always work in groups, and we always try as much as possible to collaborate and engage other individuals so that it will not be unilateral or an individual work. So it's like a collective action, individual targeting. Although I do have heard red tag or identified as enemies of the government. So they have it more difficult, those human rights defenders. For drug policy reform advocates, we do have a bit of space to engage with our government partners, pushing for more civil society reforms. And in the second question, COVID-19 did affect our work, especially in the communities, because of the restrictions in mobility and in the way we can implement our programs. That restricted our work. And at the same time, access to justice for individuals who are in conflict with the law. So there seems to be a bit of a problem for women incarcerated in prison, for pregnant women, for persons deprived of liberty. So because of the COVID-19 situation, that has greatly impacted our jail and prison situation. And as we know from our data, about 85 to 90% of detained population are for drug-related offenses. So that sort of made our work more urgent in terms of pushing for decriminalization and putting people out of jail and prisons.
Thank you so much, Lee, for your very good and comprehensive answer. I see that we have 1 minute left, and I think we just got one more question in the chat, and I'll read it. Decriminalization alone is not solving the problem of the drug supply. Are there any initiatives in place that would enable safe supply of the most commonly consumed illicit drugs? I am not sure who would like to try to answer that. Adria, would you give it a go, or and Ariel also perhaps? Adria, you have the screen.
I can take that one on. Thank you, Madam Ambassador. Yes, of course, there are, as you know, across the world, there's a rising wave of initiatives to legally regulate drugs, which means access to safe supply. And that's happening basically on cannabis, though not only, with a huge number of initiatives in the US at the moment, and also growingly in Latin America and in Europe. The important thing to remind here in connection with our discussion is that these initiatives should not be disconnected from decriminalization and from criminal justice reform. You can create a legal drug market and at the same time continue criminalizing people who use other drugs that are not legalized or who use them in a way that's not allowed in the legal framework. For instance, because they are used in the streets or they are sourced from the black market. And the people who will be decriminalized under these environments will still be those who are most marginalized and oppressed. So it's important to implement legal regulation and criminal justice reform at the same time. Thank you very much.
Thank you very much, Adria. We have unfortunately gone 1 minute over time, but I would like to take this opportunity to thank all 4 panelists. I would like to thank all of you who joined us, which was actually a lot of participants. This discussion, I'm sure that we will continue both here at the CND and in various civil society organizations and at the country level. I will not say any concluding words. I would just like to thank each and one of you for participating today. So I wish you a nice day for the rest of the day, and goodbye.